Hey everybody, Chad Madden here with Breakthrough, and today I'm talking with Tom Dalonzo-Baker. Tom, just like you and I, is a private practice owner of Total Motion PT. Now you probably know Chip, Indiana, who took over that practice. Tom is also the founder of Total Motion Release. You've heard me talk about this. We had a PTA take his course. I think it was 13 or 14 years ago now, and I remember just applying Tom's methods in our clinic and seeing some ridiculous results that didn't necessarily make sense to me. Anyhow, during this state of emergency, I'll call it as of right now, wanted to get you some information about how you can treat, how are you possibly going to treat somebody with telehealth. So anyhow, Tom, long-winded introduction, but thank you for doing this. Welcome here.
Hey, thanks, Chad. Absolutely. More than happy to help. It's a great opportunity to telehealth to hopefully open up to people to see that we can maybe help and give you guys hope for what's going on in your situation.
Awesome. So the first thing that I'd love for you to talk about is, from experience in telehealth, one of the biggest thing, when we're in the clinic, we can do test, treat, retest.
Yes.
When we're meeting like this with a patient, essentially we want to have that same exact fundamental element in there. Yeah. So we're providing a valuable service online, even if we can't provide hands-on therapy, or we can't do hands-on motion guiding. So yeah. With Total Motion Release, how does that work? How would you go through? And if you want to walk me through an exercise right now.
Yeah, absolutely. So look, it's important to have a system down, just like you have if you're working with them manually, right? And the thing you need to realize is that we're only ever dealing with motion. And that's what's really cool here, right? You're either moving them or they're moving themselves. So all you want to be able to do is to take that area. So if somebody's got a shoulder problem, right? What are the motions that we want to take them through? So Chad, if you had a shoulder problem, I'd take you through what? Flexion?
Yeah, great.
Up through, right? Might take you into abduction. All right.
So, left is bad, Tom.
All right. So abduction, right? I just want to really focus on that area. Let's just say here.
Left is.
Let's get some.
Oh, come on, man.
Pinching stuff.
All right.
Awesome.
All right.
Okay. So is that enough? Is that enough stuff to say that you got what you needed to get to there, Chad?
I'm aware that my left side has some issues. Yes.
All right. So what are some of the ways that we could go ahead and treat that?
Okay. So like you and I talked about earlier, or at least what I would know is if the right side is easier, most of us are familiar with the idea of directional preference, right? Yep. So if the right side is easier, what I've done when I've implemented TMR in the clinic is I would have the person move the right side and let's say do two sets of 12 of abduction and then go back and retest. So we're still using that test, treat, retest.
Correct. Absolutely. Absolutely. So yeah, one of the things is we've got, and I think you were going to share this with us, on the website, we've got on totalmotionrelease.com, I've got a free training for you guys right now that is extensive. It's right there. It even gives you 2 credit hours, CEUs, and it'll get you going into feeling incredibly comfortable on treating people in telehealth. This was just developed about 4 months ago. I gave you the latest and greatest information. Right, it's going to show you these videos right here that you have are treating. I show you the pre-testing. I show you the treatment. I show you the post-testing, right? And it'll give you a very good, wow, I can do that. And there's 3 ways in which to test the entire body. There's 3 ways to treat the area of injury. And we show you a system to do that so you feel comfortable like, wow, this isn't that difficult. In fact, it's pretty simple to do, right? And my first step is get up there, get the free training, right? It's going to take you through like 15 steps, right? And by the end of it, you're going to say, hey, I'm feeling comfortable with doing telehealth with people. Right, on here, I show you how long it lasts. I show you why it works. I show you theories behind it that are very simple to get involved with it. Okay. Great. That fair? So with your shoulder issue, Chad, we could go and try to treat into restriction. Right? It's not lifting. very well. We could do it like we're used to, like TheraBands, or they don't have TheraBands at home, so we may just treat it. Now, we can also shorten that tissue by coming over here. We're actually shortening the tissue on that side. Right? So there's two different ways in which to go about and tackle an issue. It's either going into the restriction or going into ease. And when you get involved in that, it's pretty simple and easy for your people, not only just your therapist, but also your patients, to grab a hold of that and say, I can do this. Right? So very powerful, very good. And I always say, just get to the website, watch a couple of videos and say, hey, I think you'll be able to say, I can do that.
Awesome. So two stories I want to share with everybody watching. Number one is we had so again, this is right after our PTA had taken Tom's course. First patient we ever treated in the clinic had a full thickness rotator cuff tear, diagnosed, it was 2 or 3 years before. She was in her late 70s or early 80s. And because of all the comorbidities, did not qualify. They wouldn't operate on her, essentially. So we had her go through, and we have this on video. It's actually on an old mini disc. That's how long ago this was.
It's a long time.
And she, we had her abduct each side. I think with the left side, she ended up having maybe like 70 degrees. Like, it was very limited. Horrible scapular winging, the whole deal, just no control there at all. We go through everything. We found a contralateral hip restriction. We ended up having her do some seated straight leg raises. And I remember as George was like going through this, I said, there is no way that this works. And I can't wrap my head around this. Anyhow.
You're doing legs to quote fixed shoulder. Is that correct?
Yeah, exactly. So anyhow, and we said, okay. And we said her name, Mary, that is a fictitious name. And I said, Mary, raise your arm. And she said, I don't know why you're having me do all these movements. And her daughter was there, and her daughter is very, very loud. And she went off she caught it. And the patient, Mary, did not even realize that her arm got better. And she was a 7 out of 10 pain before. Now she had no pain at all. Her daughter is freaking out. Everybody in the room is looking over, and we're like, wow, there is something here that we can't explain, but we don't really care. We just know it works.
Right.
Second story is when I treated the gentleman from Calcutta, India, over 18 months, we did telehealth. He was, I don't know why I remember this number, 7,937 miles from Calcutta to Harrisburg. So we were 8,000 miles apart.
Okay.
I treated him once a month. And I was paid for the entire treatment plan. But we got to a point of where, and he had 3-level disc herniation on an MRI before the treatment. And I wrote about this in both of our books on back pain, and we were featured in a local paper and got some local press coverage out of it regarding telehealth. Big secret was I used TMR when we got him to a certain point, and he still had some restrictions, primarily unilateral hip restrictions.
Yeah.
That were, we just couldn't seem to shake it with normal exercise. And I said, hey, let's do a general screen. We took him through 5 or 6, I forget what it was called at the time.
Fab 6.
Fab 6. We took him through those movements, and we found 2 restrictions. Off the top of my head, I believe it was thoracic rotation was one, and I think he had hip restriction as well. We treated him with your system, and that was the game changer for him. I mean, he was like 70% better. And by the way, when he was done with treatment, he went back and got another MRI showing complete resolution of all 3 levels of disc herniation. So if you're watching this and you're considering telehealth, you're going to need a system to treat people where you're getting effective before and after, rather than just taking people through exercises, which is, I think, an essential part once you correct their movement. TMR can do that for you. I'll leave it at that. So if that doesn't convince you to check out
let me jump in here for a second, because I'm a teacher. I just want to add a little bit, because we were talking about left to right side, and all of a sudden he jumped from shoulder to leg. Mm-hmm. I want to give this idea that pretty much we as clinicians, if somebody comes in with shoulder pain, we're looking at neck, shoulder, and ribs. That's the general area that we go to. When you do understand about lengthening and shortening tissue, you're going to have 3 areas of the body, but you're going to realize every extremity, every area of the body, the left side and the right side. The left side can be used to fix the right side. The bottom right side can be fixed to fix the right side. And the left side can be used to fix the right side. When you see that, you're going to be able to go, whoa, I can just move the body, see what's going on in it, and have an idea and a system to test and to give them that to treat. Because the big thing that you're going to notice with TMR is your skill set is going to be given to the patient, which is incredibly powerful. So they're going to be able to help the other 23 hours out of the day too.
Yeah.
Right?
And Tom, we've seen that time and time again where, you know, somebody has a shoulder or a cervical issue. We ask them like their medical history, and it's like, nothing really going on, but I do have a total hip, total knee, or an ankle surgery. And then we resolve the restrictions that they have there, and then all of a sudden their shoulder or their neck moves better.
Yeah, it's true. We've got jaw pain people, right? They can't open their jaw. And we go, hey, do a leg raise, right? And the right side's horrible. The left side's really good. We do the left side a bunch. The right side picks up, the jaw opens up. And you go, what? All right. And it may sound like so far-fetched, and we're not trying to do that because the system can start anywhere from single-digit addition, if you will, all the way up to trigonometry. But it's very simple and easy to progress through it. I do recommend just go. There's so many people asking about the telehealth, but, you know, some of you guys are so concerned about, can we do it and can we be consistent, so that people go, well, I don't want to do that. My recommendation is, if you've got concerned patients that they go, well, I'm not sure that's going to work. I mean, offer them a session, right? Let them see it. You can even bring into Zoom, and you can have multiple people. You can do your workshops via this too if you need to, or you can just have, hey, on Monday night, we're going to do this. Anybody who wants to attend to see how well it works, you can do that if you happen to be one of the places that is closed down. Hopefully you haven't. I know Washington's getting pretty bad.
I am hoping we are essential.
Yes. I was just at the chiropractor right before this meeting and stuff, and he said everything's flowing really nicely. He said a couple older patients have called in, so he's on the same idea.
Yeah. We did have record attendance last week. I'm hoping that holds up this week as well. But Tom, I appreciate your time. I know you're a busy guy, and thank you very much for sharing your system here. I appreciate it.
Hey, you bet, Chad.
Thanks.